So we know that we have a recent FDA approval for subcutaneous nivolumab. Does anybody here have experience using it? What are your thoughts?
Yeah, sure. So I led the registration trial, which was to compare nivolumab subQ versus nivolumab IV. This is the 67T trial. I think it was very interesting to run this trial because it's, it may not mean a lot, but it's huge for patients and also for our healthcare system. Because the ability to have a drug that is being administered 5 minutes, flat dose, walking, walkout versus IV 30 minutes is quite important in how you schedule your infusion room and for the patient quality of life. So the way the study has been designed, it was a PK, primary endpoint study, but also powered for clinical endpoint, response rate. And it was only as single agent in second or third line for patients with RCC. And so the study has been presented and published in Annals of Oncology. Is really a registration trial because it demonstrates a non-inferiority of the subcutaneous administration in terms of PK endpoints, but also in terms of clinical endpoint. And interestingly, actually the exposure with subQ was a bit higher. And with regard to response rate was just a few percentage higher as well. And PFS was a bit longer in the subQ. And so I really feel that it's a proof of concept that in oncology, we know that we want to move from IV to subQ. This happened with HER2 targeting. Now it's coming with immune checkpoint inhibitor. Atezolizumab actually was the first for PD-L1, and now it's the first PD-1 that has been approved late December by FDA. And it's interesting to read the label because it's not only for RCC. It's broad approval because it's the concept that you can use an agent in a more convenient way for the patient, irrespective of single agent or in combination with chemo or with VEGF targeting. We spoke about cabo-nivo, or as the maintenance after nivolumab, ipilimumab, when you switch to the single agent administration. So I'm very happy because I think we're opening new opportunities for our patients, reduce the time they spend in a hospital. Mm-hmm. And I think it's worth going into those friendly approach for the patient, but also in the way we manage our hospitals.
Absolutely. I think there's a huge quality of life benefit to spending less time in an infusion chair. And so the rest of you, do you have the availability of subQ Nivo in your institutions?
They're reviewing it now. They don't let us weigh in. It's usually the pharmacy team, nursing, that decides these things. My guess is they'll probably approve it for the reasons Laurence said. I mean, we have a shortage of treatment nurses. Right. So, this will help increase the number of people we can treat in a day and, potentially has impacts across multiple tumor types. So, anything to get more patients treated will probably get the thumbs up, but it hasn't gotten the thumbs up yet.
No, I definitely agree. I think staffing shortages are an issue, and that will definitely help.
Yeah.
Yeah, our institution is in the same situation. We don't have it approved yet. I expect it will be because, like I'm sure all of our institutions, the infusion center is overbooked, and this can help reduce some of that load. I keep having dreams at night that eventually the next press release I see will be patient self-administered Nivo. That would be that would be the ultimate convenience. That would be so nice.
The Ozempic combo.
Yeah, because on this note, I mean, I'm so glad that people have, like yourself, Laurence, have put in the effort to do this trial because, the administration and convenience is very helpful and important for the patient's quality of life. I mean, maybe it's just my regional experience and that's it, but like at least in our region, it is common for patients to have to drive, 3, 4, sometimes 5 hours to get to the infusion room. Whereas if they could do that, self-administered at home, that would just, be a tremendous advantage. But at least reducing the amount of time they have to spend in the infusion center is a good first step. I just keep hoping BMS will go a little bit further.
So I can give you the example we have in France. We're doing home administration. It's nurse administration, but it's home administration for PD-1.
That's wonderful. Maybe that's the future.
I think it's very convenient.
And as someone that was involved in the trial, did you see any differences in terms of toxicity?
Oh, it's a very good question. So there's two aspects to that. The first one is no increased immune-mediated toxicity, okay? So no new safety signal to the one we knew already with the IV. And the second one is local administration, so local reaction at the site. It was only low-grade toxicity, okay, grade 1 and 2, that would revert. So I think this is very encouraging. It did not lead to any treatment discontinuation. So I think the safety of the local administration as well as the overall immune-mediated toxicity was the same. That being said, we had a level of ADA, so antibody-drug reaction, and so that was closely monitored to see if it was associated with any differential activity or toxicity, and the short answer is no, okay? So a bit more ADAs, but no signal in terms of activity.
Yeah, it's great to hear about the toxicity profiles still being comparable to the IV formulation. And Regina, do you have any experience?
Not yet. It's same situation being reviewed, but you know, having trained somewhere abroad in Latin America, I think this is one of the very big steps forwards we can do, like from a global oncology perspective. That same thing as you experience in your center, that patients don't need to travel for such long distances for so many hours, that I think making these efforts, maybe aiming at, I want to say, like endpoints we easily forget in the clinic. Like instead of spending, the other day it's going to be like 1-2 hours when they get in, they checked in, they sit down in the chair, get the infusion, the whole thing, it takes hours. Like going from that to only like a 5-minute thing, and they're free to go back home, go to the things that they actually care about. It's such a nice, important step forward. So actually, it's very nice that these efforts are being made.